Hello everyone, before we start, I would like you to prepare a pen and paper. We will take a test measuring your happiness level. You can pause the video if you like. In front of you is the Oxford Happiness Questionnaire, which can measure your happiness level. Reflect on your emotions over the past few days, weeks, or month for an accurate measurement of your happiness. Instructions. Kindly find the test in the description below. The title is Oxford Happiness Scale? Then click the link. Follow the instruction on how to get the result. And lastly, be honest with yourself. After knowing your result, what's next? What should I do with this result? Give yourself a time to reflect. Ask yourself this question: what are the reasons for my current level of happiness? For those of you who generally feel pretty happy, that's awesome. But if you're someone who's been feeling a bit down lately, don't worry. There are various reasons that might be causing this. Try to remember your answers and see which ones you rated 1, 2, or 3. The reason that gets the lowest score is likely the main factor affecting your happiness. However, remember that there could be other things contributing to how you feel. Later, I will provide an explanation of potential interventions or actions you can take, especially if you fall into the low score category. For now, let's talk about the happiness model of Dr. Sonia Lyubomirsky. As you can see, this is the happiness model. These 3 factors are the big contributors of why people's happiness are fluctuating. These are life circumstances, genetics, voluntary actions. Of course, there are many theories in happiness, but this model is highly researched for decades already by Dr. Lyubomirsky. This may not answer all your questions, but at least might help you understand the contributing factors your very own experiences. Let's dig deeper. Let's discuss the 3 factors one by one. Let's start by talking about our life situation. This includes the challenges we face, like tough times or natural disasters, and where and how we live. It's things like dealing with traffic, having a safe place to live, having enough money, finding a job, and how much education we have. Even our general attitude matters. For example, if things are going well and opportunities are showing up, that's a stable disposition. It's also about having chances for more education and living in a good place without war or pollution. All these things together make up about 10 of how happy we feel. The second factor influencing your happiness is genetics, often referred to as our set point of happiness, according to Dr. Sonia Lyubomirsky. As explained by Sonia Lyubomirsky, each individual has a default level of happiness. This baseline is influenced by genetic factors, essentially something you are born with. When positive events occur, your happiness tends to increase, and when negative events occur, your happiness dips slightly. This phenomenon can be likened to a happiness thermostat, which rises with positive experiences and falls during challenging times. Even in the face of adversities, your happiness tends to revert to its set point. This means that if you are naturally inclined towards happiness, you will consistently return to a state of happiness after experiencing the discomfort of challenges. One of the examples to determine whether we have inherited happy genes from our parents or even from our family tree. Think back to how your parents dealt with stressors or problems in their lives. What were their behaviors afterward? Did they struggle to recover, isolating themselves in their rooms for days? Or did they show resilience, processing their emotions and using healthy ways to cope? And lastly, voluntary actions or internal state of mind. These are the things you can control. Do you have an idea? What are those? Things you can control include your behavior, the activities you try to explore, healthy social interactions with people, and your decisions, among other things. We can't really change how we're naturally wired inside, and the things that happen to us in life don't have a big permanent effect on how happy we are. However, we can make ourselves happier and keep that happiness going by doing things on purpose. If we look at people who are really happy, we'll see that they don't just sit around feeling good by chance. They take action to make good things happen. They learn new things, work towards achievements, and manage their thoughts and feelings. In short, the things we purposefully do have a big impact on how happy we are, more than just our natural tendencies and the situations we're in. So if someone who's not very happy wants to feel interested, excited, content, peaceful, and joyful, they can learn from happy people and develop those same habits. Understanding this, what does this formula imply? What actions can I take? On this slide, we have the formula for happiness. We talked about the pie chart earlier. V stands for voluntary action, C represents the circumstances in your life, and your genetic disposition adds up to make your happiness. For example, let's say your natural happiness level you inherited from your parents is quite high, giving you around 48 to 49 happiness right from the start. Then, your career is going well and you live in a safe and secure area. Sure, you have to deal with some traffic, but it doesn't really mess up your work. Let's estimate this adds around 8 to 9 from the circumstances. Lastly, you make an effort to exercise, connect with others socially, maybe once or twice a week or even monthly. You have hobbies like cooking or trying new things, and these activities make you happy. Let's say this contributes around 38 to 39 to your overall happiness. The percentages I mentioned from these factors add up to your total happiness. But remember, this is just an estimate. Now, this was the question I asked earlier upon explaining the happiness model. What did you realize? Feel free to pause the video and reflect. I want to emphasize this point. Happiness isn't about pretending to be happy all the time to the extent of faking yourself and ignoring your negative emotions. Happiness is the byproduct of your beliefs, thoughts, and behaviors. It should be genuine and not forced. Some of you may already have the answers regarding why and how you can shift away from that mindset. These strategies are built on the test I had you take at the beginning of this discussion. If you haven't, please check the description and look for the Oxford Happiness Scale. On the next slide, here are the things that you can do based on your scores. People who have 5 to 6 points on your happiness scale are the ones who are thriving. This doesn't mean they don't face challenges in life. Rather, they are adept at handling their emotions effectively. They have control over their lives due to their healthy, daily decisions. They establish connections with others, pursue hobbies, and engage in more positive activities. So keep up the good work. The score range of 4 to 4.49 represents the average score for most individuals. People falling within this range experience a kind of doing okay, but not thriving or trying new things state. Essentially, they are within their comfort zone. Take a moment to reflect on how many days, weeks, months, or even years you've been feeling this way. While it might not be consistent, it tends to recur. An effective intervention for this is to identify what's missing in your life and develop an action plan to address it. Try to socialize more or explore new activities you've been wanting to try. For those who need guidance, consider getting a coach who can provide you with advice and techniques to gradually address your specific concerns. At this point, there are big reasons why someone might be feeling down. But let's start by thinking about how long these feelings have been going on. Has it been just a day or two, a week or a few weeks, a month, or even several months? Could it even be happening on and off for a year or more? Is there a pattern where you sometimes feel really good and then really bad for a long time? If this kind of up and down has been going on for a while, it might be a sign of a mental health issue like depression. For example, if someone has been dealing with really strong feelings of sadness for the past few months, or even worse, for years, it's important to take their mental well-being seriously. In cases like this, it's a good idea to see a mental health professional who can assess the situation. It's also important to focus on healthy habits. Make sure you're getting enough sleep, eating well, drinking water, and getting some exercise. Remember, seeking help when you need. It is a sign of strength, and taking steps to take care of your mental health can make a big difference in how you feel overall. To sum up, according to the happiness model, there are outside forces that make a significant contribution to our negative emotions and have a huge impact on our overall well-being. These factors might include the environment and inherited temperament. The key point here is that we can take action by altering our thoughts and engaging in activities that bring us joy, purpose, and meaning in our lives. Through these actions, happiness can be experienced. That's it. Hopefully you get something valuable from this video. Thank you for watching and stay tuned.